Well, hello there. This is Michelle with Pooch Parenting. I wanted to talk today about what in home birth workers need to know about dog and infant safety. This is super important because I find that a lot of doctors and people who support expecting families don't even know necessarily if their clients have pets, and pets can certainly impact the trajectory and the outcome of life with the infant and inside the family and all of the dynamics that will follow. Some dogs have a really hard time with babies, some are predatory, some might be ambivalent, which is good, but parents might not know the things they don't know about how to keep everybody safe and how to prevent accidents in the future. And so I wanted to record an episode to support people who work in the homes of their clients, birth workers, lactation consultants, doulas, midwives, night nannies, etc., who may find that the clients they're working with have dogs. And one of the things that I want to begin with is just, again, to encourage you in your intake interview as you're getting to know your potential new clients is to find out if they do have pets, because this is going to impact your job with them as well. So, for example, if you're not comfortable around dogs or if you're allergic to cats, this is something that you should know. But if you're not super comfortable with dogs, you really need to know that they have a dog, and you need to set up a safety protocol so that you don't feel in danger when you go into these people's homes to support them with their new baby, especially when tensions are running high, if things might not be going smoothly, or if there was a traumatic birth event where people are very tense at the idea of even bringing this new baby home without constant nursing care, for example. So I want to encourage you to listen to the things that your clients are going to be talking about and to pay attention to things that I consider to be a little bit of red flags for you. Maybe not red flags per se, but perhaps things that will alert you that you need to pay extra attention. And you may ultimately need to bring in extra support to help this family to be more successful. So, for example, your clients might make comments in passing saying things like, our dog is reactive and we're worried about their overstimulation when the baby's in the house, or I'm worried about making the dogs feel included when the baby comes home. Or possibly, my dog has never been around kids or babies. I sure hope this goes well. Some people will say things like, my dog doesn't even like kids, so I'm worried how he will react. Or my dog tends to get protective of me. These are all things that you need to be paying attention to, because at the end of the day, you're a baby expert. You're not a dog expert. And so there is a pretty good chance that you may need to bring in some additional support to help you to ensure that this family is getting along in harmony and that we are not putting anybody at risk for any safety challenges down the line. So I want to focus on some red flags that will indicate if you definitely need to bring somebody in to help you out. And then I will give you some guidelines on who you can bring in and the types of professionals that would be adequate for a situation such as this. So the first red flag, of course, is that you don't feel comfortable yourself around the dog. Maybe it's barking and lunging at you at the front door, or it's growling, or it's giving you like stink eye or something like that, and you're not feeling safe. It's possible that you, again, notice that your client starts talking about the dog acting protective or jealous, or maybe the dog has a bite history, for example, and that is something that comes up in discussion. Another big red flag is if the family talks about how they don't understand how their dog feels, or they don't know what their dog is thinking, or they're not really sure how to read their dog's body language to determine if it's feeling stressed. Another huge red flag is if your client's dog sleeps in the same room as the baby. So if the family is co-sleeping with the baby, the dog should not be in the bed, for example. If the baby is in a bassinet in the room, then the dog can't have any access to that bassinet while the parents are sleeping, because we've heard sadly, time and time again, of incidents where a dog gets into the bassinet during the night and the baby ends up dying. Not even necessarily because the dog attacked the infant, but maybe the infant got smushed or smothered or damaged in some other way. These things are tragic, but if we know better, then we do better collectively as a community. Another red flag is that your client is just feeling super overwhelmed. They don't know how to manage their space. They don't know how to maximize safety. They're feeling super guilty about the lack of attention that their dog is getting because their dog was their first baby. And so I want you to be paying attention for things like this. And if you do start to notice conversations like this, I don't want you to panic. I do want you to get help. Now, of course, I am somebody that specializes in this. So, little self promotion here. My website is poochparenting.net, and feel free to reach out to me. This is literally what I do. I have programs that can help folks. I have online support communities for new parents that are especially great during the first year home with dog and baby, but even important moving into the phase of life where the baby becomes mobile and toddlerhood. That's very hard for dogs. If for some reason you didn't want to work with me because I work with my clients remotely and you want to work with somebody who's local to you, I advise you to look for only working with positive reinforcement dog professionals. The Pet Professional Guild is a great example. You can look things up through the CPDT organization, etc. So there are a variety of places. IAABC. Please don't be confused with the IABC. Please don't look in that directory. The IAABC directory also has some great professionals that have signed on and sort of agree to the same type of ethos that I'm talking about. The reason that a positive dog reinforcement professional really matters here is that we cannot ever take any risk that somebody does something aversive to the dog and then the dog makes an association that pain or discomfort or fear came from the baby, because that's going to damage any potential relationship that they will have in the future. It's crucial you work with somebody who understands dog behavior, but if you're going to be helping a family with referrals to manage dogs and infants, it's absolutely crucial that these people have either experience with babies, with parenting. They don't necessarily have to be parents themselves, although that does help. I personally am a parent of two, one biological child, one adopted child. I have a teaching credential and I taught for 16 years. And of course, I've been a dog and child specialist for over 7 years at this point. If you're also really nervous, again, don't panic, but I want you to implement separation immediately between the dog and the infant. And that can be accomplished by using baby gates or pens or closing doors, or perhaps the dog can go stay with the grandparents or at a dog sitter while you bring somebody like me into the picture to try to support this family. If that dog is acting predatory, or if the parent is not getting the dog out of the sleeping space, these are going to be big problems down the line. We can't guarantee, of course, that a dog will have trouble, but in my experience, a lot of dogs do have trouble. It's not always dangerous trouble, but a dog can get underfoot. It can be a tripping hazard in the middle of the night. There's a number of things that can happen. And a dog that's waking up all the time during the night is not getting enough sleep, which means that a tired dog is a cranky dog. And that's something that we have to think about. Now, there are different levels of support that you can bring on. I am kind of the first line of defense. So I help parents put together systems. We manage the house. We look at their space. We can even come up with a bit of a training plan to support the dog and how the dog is feeling around the baby. But I love management. I love simple, realistic, practical strategies that exhausted parents can implement. But sometimes I will notice that it's not enough. And sometimes dogs need medical intervention. And so at that point, I would recommend bringing in a veterinary behaviorist who can help to modify behavior through the use of potentially of medications that can help the dog to learn new information, to reduce anxiety, to maybe take the edge off a little bit so that the dog isn't quick to bite, for example, if the dog is extra stressed. And I have lots of people that I love to refer to. In particular, I'm a huge fan of the Animal Behavior Clinic in Portland, Oregon. Sometimes you can work with their veterinarians, even if you are out of state, if they can partner with your local veterinarian to collaborate. So that is one recommendation that I would have, but please feel free to reach out to me and I can support you with that. Now, another question that you will be asked a lot about if you are an in-home birth professional is how to even bring the baby home in the first place, how to safely introduce them, because people put a lot of pressure on this situation because of crazy things they see on Instagram and TikTok. And a lot of that stuff is a horrible example. It's dangerous. It's unsafe. I have a community of expecting parents that I work with to support them. And I always show them crazy videos that I find online because people are doing really dangerous things. And if we normalize those, then more people will repeat them. And one of the most common things that people always recommend, and I'm not judging you if you've recommended this in the past, but I don't want you to recommend it anymore, is the idea that they should bring a baby blanket home from the hospital for the dog to sniff, or bring home a baby hat for the dog to sniff. It doesn't really matter. It's kind of a waste of energy, and you're putting a lot of energy of like sending a parent home from the hospital to run it home and let the dog sniff it and go back to the hospital. But you know what else that baby blanket or baby hat smells like? It smells like nurses and disinfectant and laundry detergent that the hospital uses, and the dozens of other folks that have been around the baby, etc. Yeah, maybe it does smell a little bit like the baby, but if the parent who's bringing it home for the dog to smell doesn't make a distinct effort to make that a positive thing, a positive experience for the dog's not going to know why you brought it home. It's kind of like when you go to the grocery store and you come home, you smell like the grocery store and you smell like the 100 other people at the grocery store. We don't make a big deal about that. I don't think we should make a big deal about the blanket. It can also get dangerous, frankly, because if you bring a baby blanket home from the hospital and you leave it for the dog when you go back to tend to baby at the hospital or the birthing center, maybe the dog is going to lay on the blanket. Maybe the dog is going to shred the blanket. These are not behaviors that we want the dog to practice. So pretty please do not make the recommendation that folks do that. It's not worth it. There's no point. Now, you're also going to need to set appropriate expectations before they bring the baby home. So for example, everyone wants their dog and baby to be best friends. And I think that's sweet. I think that's adorable. Their dog was their first baby and we have to honor that. But they have a lifetime to build a solid relationship. And so it's important to me that we not rush the process and that we not focus on this weird expectation that they're going to be best friends right away, because it's not going to happen. An infant is not going to be best friends with anybody for quite some time. Really, they're mainly going to only have eyes for the people who give them milk at this point. And the dog might be interesting to look at, but infants come ingrained with a grasp reflex, and we don't need the baby close enough to the dog to grab a fistful of fur, because then from the get-go, the baby is not a positive influence on the dog. Okay, so coming home can be a tricky process. I would encourage you to have your clients meet the dog before the baby even enters the picture. So come out of the car, say hi to the dog, get rid of some of that excitement. I want mom to be able to get settled in the house without worrying that the dog is going to bump into her or any of those kinds of things. And I want somebody to have the dog on a leash pretty much at all times, because we cannot risk mom getting hurt or baby getting hurt. And then I like to encourage somebody to do sort of drive-bys with the dog at a distance, passing mom and baby from the other side of the room, on the other side of a barrier, always on leash. Maybe get a little closer if the dog is relaxed. And if the dog isn't relaxed, don't get any closer. And then I have some other strategies, but I don't want to share all of them here because I am really afraid that if you share them and you don't share the correct information, that your families are going to be set up to fail. So, but using these layers of protection is a great start. Please don't put the car seat on the floor and let the dog sniff it. There's no need for the dog's teeth, as we say, the pointy end of the dog, to get close to the baby's head, neck, vital parts of the body. It's absolutely unnecessary, and I don't think it's a good idea. I also want you to set up the family for appropriate expectations so that we're not encouraging the dog to look at the baby. Because I've seen so many videos of people like, look at your new sister. Isn't she amazing? Come close. Come see the new baby. Come stare at the baby in the crib. Come get in the crib with your baby. These things are ridiculous and unsafe. And instead, I would rather you reward the dog for being ambivalent to the baby. I don't need this to be the focus, right? I don't want the dog to be focused on the baby. I'd rather them be somewhat ambivalent. Because you're a baby expert, you're probably not super familiar with dog body language. This is another great reason to refer out to a dog and child specialist. There are all kinds of clues of dog body language that indicate that a dog is stressed, and your families should be able to recognize these signs so that they can intervene and make sure the dog and infant both have a safe space to retreat to. There's never any reason they should be together. Really, there's just not. Safety and management is, again, it's something that you're going to need to encourage. I'm a huge fan of baby gates and pens, setting up a pen, for example, where you put the baby down for tummy time inside the pen, and then the dog still has free reign of the house. I think that's a great strategy. Newborn babies don't need to move very much, and there's no reason at all for the dog to have any access to the play gym or any kind of mat that you lay on the floor for your baby to have tummy time on. So putting a pen around the newborn is a super idea. It also gives you a little bit of guilt alleviation for the new parents, because they get to spend a little bit of time with their dog if their baby is safely contained. Now, safe sleep is something that I've mentioned already. It's really important that there are no loose dogs in the bed or in the room where the baby is sleeping. And I have other resources that I can share with you. Feel free to reach out to me. I have handouts about safe sleep, and I'd be happy to send those to you or to your clients. Or if your client wants to work with me or join my Pooch Parenting Society, where they get ongoing support for that first and second year, I share lots of resources with them to keep whole families both physically and emotionally safe. So if you are an in-home birth professional, doula, lactation consultant, night nanny, midwife, etc., please, again, pay attention. Excuse me, my dog scared me. Please pay attention. Do your families have pets? And if so, what do you need to do in order to support them to the best of your ability? I hope you found this helpful. Again, my website is poochparenting.net. And if you need anything, again, please reach out. If you would like to encourage your clients to join my membership ongoing support in a really affordable way, they can go to safekidsandogs.com to join the Pooch Parenting Society. I hope you found this helpful. Take care. Thank you for listening to the Pooch Parenting Podcast. If you enjoyed today's show, please subscribe on your favorite podcast player and leave a review. But even better yet, tell a friend. Are you in some moms groups, perhaps? Or maybe you're friendly with your pediatrician. Please let them know that resources like this exist, because the information that I share with my people goes beyond what most baby books offer, and a lot of parents need support. You'd be doing them a favor. Thanks again. Have a great day.